Hey, wanted to talk to you about an article that came out yesterday in the Journal of the American Medical Association, JAMA, about a medication to treat menopausal hot flash symptoms called elinzanetant. Elinzanetant is a medication that works on two receptors on nerves in the brain that help regulate temperature. So the idea is that it will help with thermoregulation, hot flash symptoms, and sleep. Right now, the medications that we have to treat menopausal hot flash symptoms fall into a couple of categories. We can treat people with hormone replacement therapy, so estrogen and progesterone, depending on what's needed for the patient. But not everybody can take that if they've had a history of breast cancer or other family or personal medical history. And so hormones aren't for everybody. We also have SSRI drugs, which are drugs that were developed as antidepressants, but can have a beneficial effect on hot flashes. Those drugs have side effects as well, and not everybody can tolerate those medications. And we also have a couple of other drug classes that are, I would say, a little bit less effective that help with vasomotor symptoms, things like gabapentin. Now, and that medication can make people really sleepy. So none of the drugs we have are perfect. I always say nothing's free. No drug is perfect. But I think these new drugs are really interesting. So we have a drug that works and is FDA approved for neurokinin receptors. And that drug is, the brand name of that drug is Veozah or fezolinetant, and is the chemical name of it. And that drug can work for hot flash symptoms. It's a new drug, only out for a little while, and I have had patients have some success with it. So I do think it's a good drug. I think the difference between that drug and this drug that was in the new article yesterday is that the new drug targets two receptors, neurokinin 1 and neurokinin 3, whereas fezolinetant or Veozah only targets neurokinin 3. And that doesn't necessarily make it better, but there's a suspicion that the extra receptor that elinzanetant targets can be more helpful for sleep. So it'll be really interesting to see what people's experiences are. In the trial, they showed that 80% of participants achieved at least a 50% reduction in their vasomotor symptoms, so very promising. Side effects of the medication seem to be related to headache and fatigue, and they did seem to be a little more prevalent in people who got the drug versus the placebo group of people who didn't get the drug. But interestingly, in the trial, people who got the placebo later got the drug, and when they got the drug, they seemed to have less headaches and hot flashes, headaches and fatigue. So, could be very promising in terms of a treatment. I think the tricky thing that will be challenging with this drug is getting approval for it, because I'm guessing it will be expensive once it's FDA approved, which I'm guessing will happen in the next couple of months. And insurance companies are going to require people to fail these other therapies before we can get approval, which is going to be a challenge. But I am hopeful that this means there will be more options for people who are experiencing significant vasomotor symptoms in menopause. Anyway, I'd love to hear your thoughts on the new medication, and looking forward to comments and questions. I hope you're having a good weekend.